Today's topic, the introduction to the clinical use of telomere measurement, preventive and personalized medicine. I want to start by a little bit of historical information for you. Do any of you remember being at the November 2009 conference in Las Vegas? Anybody there? Okay, was anybody at my talk there, Introduction to Telomere Biology? Because I gave it to somebody. Awesome, thank you. I gave a talk that had to be one of the first talks on telomeres at the time, and I asked some questions. I'm going to ask the same questions today because I want to get a feeling for where we're at. I suspect things have changed. So one of the first questions I asked, and I'm going to ask you folks out there to answer this as well, is how many of you know what a telomere is? Please raise your hands. Okay, thank you. In the original group, which was a little bit larger than this, probably about 20 people raised their hands. I'd say we've at least doubled that. How many of you practice or are interested in practicing or intend to practice or have integrated anti-aging medicine into your practices? Okay. Of those of you who do that, how many of you measure telomeres clinically? How many are measuring telomeres in their practices? Okay, almost none of you. Good. That's good in a way because I have a lot to tell you. It's bad in a way because I'm going to have to move really quickly. So 2 pieces of information I need to start out with. If your cell phones are on, please turn them off or make them silent. And second of all, I will not have time to answer questions because we are going to have to kind of start from the beginning here with this. And so I'll be here for the rest of the conference. You can ask me anything you want. I'll do my best to answer it. I'll be at booth 206 and out and about in the conference area. Please don't hesitate to ask me questions. In the development of, sorry, am I in the way? Oh, can you, I think there should be a lav mic. I think, folks, if the AV people can turn up the lav mic a little bit, I'm actually wearing it. So anyway, some folks who I owe a deep debt of gratitude to. I'm going to show you some pictures. And we all owe a debt of gratitude to these people. This is Liz Blackburn, Joe Stosak, and Carol Greeter, the 2009 Nobel laureates. And my talk in 2009 was about 2 months after they were awarded this prize. So it was a very salient topic at the time. And the field has exploded. When I did Google News alerts for telomeres and telomerase and telomere lengthening prior to the Nobel Prize, I'd get maybe 1 a month. And almost instantaneously after this Nobel Prize was awarded, they were coming 2 and 3 a day. The field has exploded. The number of publications has exploded. And the correlation between aging, health span, and lifespan has also exploded. This is 2 friends of mine. In the center is Calvin Harley. Calvin Harley was a senior scientist at Geron for many, many years. He's given us 2 telomere-based compounds, one which is now known as TA65, telomerase activator, and also imetelstat, which is in clinical trials now, telomerase inhibitor. The fellow on, would be your left, would be Michael Fossel, my co-author of the book that I wrote. And Mike wrote a book in 1997 called Reversing Human Aging. And Mike's initial book predicted everything that we're seeing happening now. So Mike is an amazing individual, and I would call him semi-clairvoyant because everything that he said has come true. Bill Andrews discovered the human telomerase gene. This was important because the work of our Nobel laureates was in tetrahymnema, or what Elizabeth Blackburn calls pond scum. So it's nice to know that we have that gene as well in our genome. And Bill was the person who found that while working at Geron and also gave me my start in the field. It's Maria Blasco. Maria Blasco is currently one of the premier telomere scientists on the planet. She does a lot of work with stem cells, telomerase activation, and the behavior of somatic cells as well. And you'll see her again in some of the slides. But Maria was kind enough to spend many, many hours with me, educating me, teaching me a lot of what I know about telomere biology. She's also the person who created something that I predicted, and I predicted this in this book. Anybody read this book? Look familiar to anybody? Okay, 1, 2, 3, 4, 5, super. On page 120 of this book, there is a prediction, and the prediction is that there would be a new and exciting way of measuring telomere length called HTQ-FISH. At the time the book was written, it was Maria's test in a lab. You had to go to Spain to do it. You had to be in a university setting. You could not do it commercially, but it was one of the tests that I was able to do early with some of the other people that I worked with, and I knew this would become something important. That prediction has come true. There is now a company that is offering that commercially, along with some other test modalities that we'll talk about here. So I took a lot of heat for the predictions I made in that book. Almost every single one of them has come true, including that one, that telomere measurements would become more accurate, more reproducible, and even more dependable. And thus, as the explosion in studies has come up, so has the ability to accurately and reproducibly measure telomeres, which was somewhat of a sticking point for many, many years. Is there anybody out there who thinks that telomeres have nothing to do with aging?